Hello, I'm Dr. Galan, and I'm an orthopedic surgeon specializing in joint replacement and sports injuries. Thank you for choosing Adventist Health for your joint care. You have an upcoming knee arthroscopy, also called knee scope surgery. Today we will discuss how to prepare for your surgery, what to expect on the day of surgery, and postoperative recovery phase. The preoperative phase. Prior to surgery, you will need to stop GLP-1 agonist medications like Ozempic, Mounjaro, Wegovy, or Trulicity. You need to stop taking those medications at least 1 week prior to surgery. You will also need to stop medications that make you prone to bleeding. Blood thinners, medications like Eliquis, Xarelto, or warfarin. You will also have to stop medications that interfere with your platelets, medications like Plavix, clopidogrel, aspirin, and anti-inflammatory medications like ibuprofen, naproxen, Advil. We prefer that you stop those blood thinners and antiplatelet medications for 10 days prior to surgery. In rare circumstances, your cardiologist or PCP may recommend that you stop Eliquis or Xarelto only 3 to 5 days prior to surgery. When those recommendations are made, we will discuss the plan on a case-by-case basis. Other routine medications that you take, for example, for blood pressure, need to be continued. Your preoperative nurse will call and inform you when you will need to stop ingesting food and liquids prior to your surgery. Unfortunately, your stomach needs to be empty for about 8 hours prior to surgery. Soon after your pre-op visit with me, we will send a prescription for you to your pharmacy. Please call your pharmacy the next day and confirm that they have received the prescription for you. If they do not have it, please give our office a phone call as soon as possible to let us know. We want to ensure your postoperative prescriptions are filled and you will take them as directed. The postoperative prescriptions are an integral part of your healing and recovery process. We typically send the prescription for one medication for pain. Typically it's Norco, but this can vary. The operative phase. You will arrive to the surgery center at a specific time as indicated by the preoperative nurse. Please ensure you have reliable transportation ahead of time for your trip to the surgical center and back. You will go through the registration and admission process when you arrive. You will then be transferred to the preoperative suite where you will meet me and your anesthesiologist. I will mark your surgical site and we will discuss final details with you. Anesthesiologist will discuss the choice of anesthesia with you, and shortly after, you will be taken to the operating room by the nurse. Please be assured that you will have no pain during surgery. Immediate postoperative phase. You will be asleep when you will arrive at the recovery room. Once you're stable, you'll be ready to go home. Remember, pain is a natural reaction of the body to surgery. We will be monitoring your pain carefully and treat it adequately, but also safely. Your physical therapist may see you shortly after your surgery and may help you get up and walk. You do not have to walk a long distance in order to be able to go home. Some surgeries require that you stay off your operative site. Recovery. Remember, your safety is the most important aspect of your care. Please always use a walker or crutches. This is to prevent you from falling and injuring yourself. Your incisions will be right in the front of the knee. They will be very small, 2 little poke holes. You'll have a dressing covering it and a bandage from the foot all the way to the thigh. Please keep your bandages clean and dry. Ensure that it doesn't get wet during hygiene. You might need to take a sponge bath for several weeks instead of showers. Some patients utilize commercial plastic sleeves and are able to shower without getting bandages wet. You will notice that there is a small patch of skin just outside of the incisions that is numb. It is totally natural. It happens to every patient. This is a small side effect to otherwise a very successful knee scope operation. The numb area over time becomes smaller, and eventually most patients don't even notice it's there after some time. During the immediate recovery phase, you will experience surgical incisional pain, and it will last about 2 to 3 weeks. It is usually well tolerated with pain medication. Pain gets much better after about 4 weeks. The most important thing to remember is the initial postoperative recovery phase is not to overdo your activities. Some patients feel a significant reduction in pain and start engaging in activities that are not advised. Some people start ambulating without a walker. Some go to parties and dance. Some start doing household chores. Please avoid those activities. You're only allowed to ambulate with a walker crutches at this stage. Once you come back home, on the following day, we ask that you start moving your knee every 3 hours or so for about 5 minutes. Slow, gentle motion of the leg up and down, bending and extending your knee while sitting down on a bed or chair. After the 5-minute moving exercise, please get up and use a walker and walk around the house for about 10 and 15 minutes. Use your ambulation time to get something to eat, use a restroom, and exchange an ice pack if you have an ice brace. At 2 weeks, you will come back and we'll examine you in clinic. This is the time when we first will unwrap your bandages. We want to make sure that your incision is healing well. Sutures may or may not be removed during that visit. At this appointment, we will most likely allow you to shower. Please make sure you do not soak the incision or submerge it in a bathtub. No baths at this stage yet, only showers. At your first post-surgical appointment, we will send you to formal physical therapy. You did informal physical therapy, moving your knee at home every 3 hours. Healing time. You will be about 50% better and recovered at 6 weeks after surgery, and about 80% recovered at 3 months after surgery. For most patients, it is a substantial improvement in symptoms that they choose to return to regular normal activities and work at this time. Full recovery involves scar tissue remodeling, which usually is not noticed by patients, and it can take up to a full year. Questions after surgery or emergencies. If you have a question that is not very urgent, please wait for the next business hours, Monday through Friday between 8 a.m. and 4 p.m. and call our clinic. You will find the number in your folder. If you have an urgent question during business hours, Monday through Friday, 8 a.m. through 4 p.m., please call our clinic. If you have an urgent question outside of business hours, please call the hospital and they will get a hold of me. If you have an emergency, for example, if you have fallen, or if you have an uncontrolled pain, you will need to go to the nearest urgent care clinic or emergency room. We appreciate you taking the time to watch this video. Our office is here for you. Thank you for choosing Adventist Health.